Hello everyone, myself Dr. Ayush Gupta. This is the part 4 of rapid fire anesthesia. Let's start with the first topic. The first topic is cricoid pressure or Selix maneuver. Cricoid pressure or Selix maneuver is a technique used during endotracheal intubation to compress the esophagus against the vertebra and prevent regurgitation of stomach contents into the airway. That is, prevent aspiration of food. This technique is used in rapid sequence induction. The second topic is about the positions in anesthesia. This is the supine position where head and foot are at the same level. This is the Trendelenburg position. The head end is up in Trendelenburg and foot end is low. This is the reverse Trendelenburg position. The head end is low and the foot end is up. This is the lithotomy position used in gynecological procedure. This is the prone position. This is the jackknife position. This have a risk of positional asphyxia. This is the Fowler's or sitting position. This is used for breast surgeries and also for CNS surgeries. This is the left lateral or kidney position. This is the lateral position. Now we will be seeing about some disadvantages of positions. First is of supine position. The disadvantage of supine position is that it has increased risk of pressure ulcers at the dependent part. Next comes the Trendelenburg position. The disadvantage of Trendelenburg position is that it has an increased risk of aspiration and decreased respiratory function. The disadvantage of reverse Trendelenburg position is it have an increased risk of venous air embolism. The disadvantage of prone position is it has an increased risk of eye injury. The disadvantage of lateral position is it has an increased risk of compression of nerves or pressure ulcers. The disadvantage of sitting position is it has an increased risk of air embolism and it has a decreased venous return to the heart, which causes hypotension. The next topic is chin lift and head tilt maneuver. This question was asked in NEET 2023. This is the jaw thrust maneuver. The next and the last topic of this series is about capnography. The increasing pattern is known as step ladder pattern, which is seen in malignant hyperthermia. This sudden decrease is due to esophageal intubation. Here the endotracheal tube by mistake is inserted into the esophagus. This here is known as curare notch. This occurs when the patient tries to rebreathe. For the treatment of this curare notch, we have to give top-up of muscle relaxants. The next appearance is known as shark fin appearance. This is seen in anaphylaxis, or we can say bronchospasm. The next is this sudden decrease. This is due to cardiac arrest or pulmonary embolism. It can also be due to discontinuation of circuit, or we can say accidental extubation. If the fall here is gradual, it is due to hypotension, or we can say continuous bleeding. The next appearance of this capnograph is due to faulty inspiratory valve. The next capnograph where the baseline is increased, this is due to faulty CO2 absorber. The next capnograph where this type of appearance is seen, this appearance is due to cardiac oscillations. This type of capnograph is normally seen in children. The next and the last capnograph, this appearance is known as double plateau sign. It is seen in faulty EtCO2 sample line. This was all from my side regarding the rapid fire anesthesia. I hope you like the series. Please like, share and subscribe. Thank you.